Hi, my name is Beatrice. I'm a Texas State University student. So today I'm going to do a focused assessment on a 44-year-old African American male that presented to the clinic with acute onset of sore throat. He reports he's been having it since last night for the past 24 hours. He also reports that he's been coughing and no phlegm. He reports that he has pain to his frontal sinuses. He denies any recent upper respiratory infection. He denies any congestion and denies any shortness of breath. As far as his medical history, he denies any comorbidities, denies diabetes, hypertension, or any other comorbidities. Medication-wise, he took Tylenol yesterday, 2 tablets. He does take Tylenol over the counter, 500 milligrams, once in a while for pain. He also takes multivitamins once a day. Does not take any prescription drugs. As far as his family medical history, his dad is alive at age 70 with no significant medical history. His mom is also alive at age 68 with no significant medical history. As far as his social history, he denies any smoking, denies any use of illicit drugs. He denies any alcohol use. And as far as his immunization, he says he's up to date with his immunization, with the exception of flu shot. He did not get a flu shot this year yet. His last physical exam was this year in March. Allergies wise, he has no drug allergy, no food allergy, no environmental allergy. So now I'm gonna listen to your body, I'm gonna assess your body systems, okay? So first, I'm gonna start with the ears, just inspect the outer structures of the ears to see the symmetry, and it's symmetrical, the external features of the ear is symmetrical. And at this point, if I had an otoscope, I would look at the inner, the auditory canal, and it should be pink. The normal finding should be pink, and the tympanic membrane should be pearly gray, and there could be a little bit of cerumen. That's a normal finding. Anything other than that will be abnormal. If it's red or inflamed in any way, that would be abnormal. So that's the assessment of the ear. The next thing that I'm going to do is I'm going to ask you to take your glasses off so we can assess your nose. So I'm going to inspect the nose and see if it's symmetrical and midline. Then the next thing I'm going to do is check for patency. If you can occlude one nose and just take a deep breath with the one open. Any blockage? All right. How about this other one? Do the other side. Do you feel any blockage or any pain or anything like that?
No.
Okay, so next I'm going to palpate his sinuses. Any pain on your frontal sinuses?
Yeah.
Okay, so you feel pain. He does report pain on his sinuses. On the scale of 1 to 10, how bad is the pain?
About a 5.
About 10. Okay. How would you describe it?
It's like when you touch it, it's like pressure.
Okay, it's
Pressure
like
pain,
pressure. Okay.
yeah.
How about on your maxillary?
Yeah, a little bit.
Okay. How much pain?
Probably about a 4.
Okay. How would you describe it?
It's a pain, but not a sharp pain, but it's like there's pressure in there when you hit it.
Did that start with the sore throat?
Yeah, it started about the same time. So.
Okay. All right. So the next thing that we're going to do at this point, if I had a spatula, I would assess the inner structures of the nose. So I would take a light, and at this point I don't have a spatula, but I would put the spatula inside his nose and inspect the inside. It should be pink and with slight maybe hair there. But if it's red and inflamed, that's abnormal finding. The next thing I'm going to do is inspect his mouth So I'll just look at his external first. Let me just look at his external structure of your mouth. So the first thing I'll look at is his lips. Make sure that he doesn't have any cyanosis on his lips, and he doesn't. Then I'll inspect the inside of his mouth. If you can open your mouth for me. So I'll inspect his teeth, and he should no cavity there. I don't see any cavities in his teeth. And I'll inspect his palate as well, the soft palate and the hard palate. The hard palate should be, you can close your mouth. The hard palate should be concave. And if I had gloves at this point, I would palpate his oral cavity, palpate his tongue, and palpate his soft palate as well, and see if there's any nodes or anything like that. So since I don't have gloves, I'm not doing that today. What I'll do, I'm gonna inspect his throat. So I'm gonna put this inside your mouth. It might feel uncomfortable a little bit. It might make you gag, but I just need to look at your throat, okay? So I'll go for me. All right. So I do see on his throat he has some white patches, especially on the left, on this side, on the left side. He does have some white patches, and his throat, his tonsils are slightly inflamed and slightly red. So we're gonna have to do some testing to see what's going on with his throat right there. But his uvula is midline, so that's a good thing. I'm gonna also palpate his neck as well to check. Let me check your, I'm gonna have you swallow this and just feel your throat and see. All right, so then thank you so much. The next thing I'm gonna do is palpate his lymph nodes, starting with his occipital lymph nodes. Any pain? Okay, so that's the occipital lymph nodes, and they are not palpable. And the posterior lymph nodes as well, posterior auricular lymph nodes are not palpable. Then I'll palpate the pre-auricular lymph nodes. They are not palpable, which is a good finding. And also I'll palpate as well the clavicular lymph node, both the superficial and the deep, and then the subclavicular lymph nodes. All of them are not palpable. So he doesn't have any inflamed or any lymph nodes that are swollen. That's a good finding right there. So next thing, I'll go to the back of my patient just to inspect his lungs. I'll inspect his chest cavity from the side and from the back, and the back and the lateral should be 2-to-1 in ratio. So it looks good. He's not using any accessory muscles to breathe, and he looks relaxed, so that's good. Now if you can cross your arm in the front so I can listen to your lungs, just relax like right there. And I will listen to your lung sounds from the back, but before I do that, I'm just gonna palpate and see how his lung movements, if they're equal. And his lungs are symmetrical. If you can go say 99, so I can
99.
And I can feel sound.
99.
All right.
99.
So there's lung sounds and vocal sounds on all lobes from the posterior. Now I'm going to listen to his lung sounds from the back, from the posterior, starting from the apex. Take a deep breath for me. All right. Okay. All right. And there's lung sounds on all the lobes on the posterior. So now I'm going to come to the front and inspect the chest cavity as well, and just see if he's using any accessory muscles, if there's any labored breathing or any difficulty with breaths. And he's not using any accessory muscles and no labored breathing. So next, I'm gonna palpate just to see if he has any pain on his chest, the 4 areas. Any pain? All right, any pain?
No.
All right, so I'm gonna listen to your lung sounds, starting with the apex, above the subclavial area. Take a deep breath for me. All right. Okay. 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 Good. And I'll go to the lateral, just lift your arm for me. I'll go to the lateral and just listen to the lateral side of the lungs. Okay, this side as well. Okay. So lung sounds can be heard throughout the lung fields. So next I'm going to just ask him to lay down so we can listen to, inspect his heart, pericardial area, and his heart sounds as well. So with him laying down, I'm just gonna inspect the pericardial. It should be mid-clavicular on the 5th intercostal space. And then I'll palpate. And his heart rate is regular. Then I'll listen to his heart sounds, starting with the aortic on the 2nd intercostal space. Then move on to the pulmonic valve. And I'm starting off with the diaphragm, and then I'll do the bell as well. So we do pulmonic, the F's point on the 3rd intercostal space. And then my mitral valve. And the S sound, S1 and S2 sounds can be heard. The next thing I'm going to do is now listen with my bell. Same 2nd intercostal space. I'll listen to his aortic. And pulmonic with the bell this time. F's point. Mitral valve. On the 5th intercostal space as well. All right. Heart sounds, regular rhythm, no bruise, no heaves. So his heart sounds good. You can see that we are done with the assessment of the heart. So the next thing we're gonna do, since your throat looks inflamed, we're gonna do a strep test, and we'll also do a flu test, which is a quick test, and we should know today, if you do have strep, or if you do have a flu, or if it's sinuses. So we'll figure that out today, and then we can treat it. All right, thank you.